Good afternoon, ladies and gentlemen. I welcome you to today's press briefing. I am Permanent Secretary Fedra Ramming, Permanent Secretary of the Ministry of Social Services and Urban Development. Today, we assembled to share the interventions made by the Ministry of Social Services and Urban Development in this COVID-19 environment. It should be noted that while most persons are quite aware of the Department of Social Services, our portfolio is quite diverse, and it actually extends to encompass care for the elderly, the differently abled, gender and family, and community support and development. COVID-19 has changed the way in which we conduct business. Indeed, it is no longer business as usual for many of us. The Honorable Frankie Alfred Campbell has the awesome responsibility for this diverse portfolio, and he will now provide an update on what has transpired and is indeed in progress. Minister Campbell.
Thank you, PS. Team, members of the press, Bahamas, a pleasant good afternoon. In these times of crisis, disaster, and uncertainty, I have reflected on those who have gone before me, on those whose shoulders we stand. Indeed, the world stands. Mother Teresa, the child of compassionate parents, advocate, founder of the Order of Missionaries of Charity, a Roman Catholic congregation of women dedicated to helping the poor, Nobel Peace Prize recipient, and later considered one of the 20th century's greatest humanitarians, canonized as Saint Teresa of Calcutta in 2016 said, and I quote, "At the end of life, we will not be judged by how many diplomas we've received, how much money we've made, how many great things we've done. We'll be judged by, I was hungry and you gave me food. I was naked and you clothed me. I was homeless and you took me in," end quote. Her words put into perspective the need to maintain our humanity, be our brother's keeper, that we must all have a social conscience. COVID-19 is a virus that does not discriminate between the rich and the poor, between women or men, the elderly, the youth, the sick, or those healthy. Its effects are highly uneven. Healthcare and food security has become a matter of life or death. As the Minister for Social Services, my heart is towards the people of the Bahamas who have stepped outside of the normal way of life in the face of unbending obstacles, stubborn challenges, and have broken new paths to survive. I applaud you. I stand with you as a husband responsible for his family, as a father, an elder man with increased chances for transmission, as a minister with a duty to meet and work on the ground with each social worker, each probation officer, as a member of parliament, walking the lines and ensuring that food parcels are distributed. I understand. I have not forgotten, and I applaud you. I commend all the hard-working, responsible staff within my ministry. In the face of this global pandemic, I'm concerned about the general public and equally concerned about my staff. We're just as vulnerable as anyone else to becoming infected with and affected by COVID-19. Therefore, we encourage clients to practice safety protocols which we practice ourselves. Notwithstanding our measures, some of our sub-offices had to be closed for deep sanitization. Despite this, we made every attempt to accommodate as many persons as possible and continue our efforts to ensure that all of our premises are fully functional. Throughout the COVID-19 pandemic, The Ministry of Social Services and Urban Development has been dedicated to enhancing risk communication and community preparedness, provide critical supplies, improved water, sanitation, and hygiene services throughout our facilities for our employees and clients. The COVID-19 pandemic is of great concern to everyone. As a ministry, facing the unprecedented threat of COVID-19, we realized that in order to come to the aid of the ultra-vulnerable, we would need to engage the minds of the most innovative, those creative and competent. The ministry embarked upon an aggressive dual change strategy that is both transformational and incremental to make provisions for those most vulnerable. We knew there were thousands of people who were less able to protect themselves during this pandemic. Older persons, persons with chronic illnesses, and persons with disabilities face particular disproportionate risk and require an all-out effort to save their lives and protect their future. This was and is a matter of basic human solidarity. Our strategy included analyzing our infrastructure to ensure that our clients had access to our full spectrum of products and range of social assistance to stem the impact of COVID-19 in an already vulnerable humanitarian context. And simultaneously, we continue to maintain support for existing humanitarian services, which more than 20% of our population depend on. COVID-19 is nowhere near removed from our immediate future. The Prime Minister has referred to our joint commitment to survive this threat as a marathon, and we are committed to providing services to the people of the Bahamas to the best of our competencies. I shall begin with the Department of Social Services. While the various divisions within the Department of Social Services continue to offer a full complement of services, the COVID-19 pandemic has forced workers to change case management processes and to find innovative ways to assist clients. It has also compelled us to identify new initiatives that would address the economic fallout which occurred as a result. These changes and initiatives are as follows. The Disabilities Affairs Division emergency food assistance coupons are now being issued directly from the division to persons with disabilities. From March to present, 179 persons have been assisted at a total of $10,230. Disability allowance payments to 81 children continue at a cost of $330,000. The School Welfare Unit continued its daily work while interviews for enrollment in the public preschool were conducted via telephone, and the selection process is done virtually. 781 applications have been completed. Home visits continue to be conducted for the students of PACE, who are teen mothers being provided access to continued education, and that number is 41. Health social services at the Princess Margaret Hospital. We've not forgotten our elderly and those with health challenges in the face of COVID. Their continued health is most important. Hence, social services has found ways to continue to ensure that medicine and prescriptions are filled and delivered. All services continue to be provided, including home visits, which are done via WhatsApp video calls where possible. The information obtained is included in the client's assessment report. 861 med cards have been processed from March to date, thus assisting clients in receiving medication and lab work. 206 other medical services were assessed, including assistance for MRIs, radiation, chemotherapy, medication, heart procedures, etc. 153 verification reports were submitted to the National Insurance Board for clients to access the National Prescription Drug Program. In a combined initiative, the Ministry of Social Services and Urban Development and the Ministry of Health worked in tandem to relocate the borders from the Princess Margaret Hospital to senior residential facilities. This joint effort is budgeted to cost approximately $800,000 in the first year for care and needs of the residents. The relocation of the borders creates much needed space for critical care. Health social services at the Sandilands Rehabilitation Center. In accordance with COVID-19 protocols, social workers delivered medication to SRC outpatients to prevent increased transmission rates. From March to present, 269 med cards were issued. Our Family Services Division, which includes Family Services Unit, the Placement Unit, the Domestic Violence and Counseling Unit, and the Trafficking in Persons Unit, have also been busy. Fear, worry, and stress are normal responses to perceived or real threats, especially at times when we are faced with uncertainty or the unknown. It is normal and understandable that people are experiencing fear in the context of this COVID-19 pandemic. The department continues to provide counseling services and legal advocacy for parents and children. Court reports continue to be generated, obtaining information, documents via telephone interviews, social media, or email. Counseling is conducted utilizing the Zoom platform. Caseworkers continue to attend court in person or virtually. Foster care allowance continued for 177 foster children at a cost of $150,000. The Community Support Services Division continued their virtual home visits and telephone interviews. Food coupons are delivered to seniors and persons with disabilities. COVID-19 special grants to charitable organizations were given to continue our essential partnerships and extend the reach of services and the continuation of the effective task force building. The Ministry of Social Services and Urban Development, through its Department of Social Services, has disbursed approximately $469,000 in special grants due to the economic fallout of COVID-19. The special grants were made to various government and non-governmental organizations, residential facilities for seniors and children, in addition to NGOs that provide food assistance to the most vulnerable in New Providence, Grand Bahama, and the Family Islands. The National Food Distribution Task Force was established by Prime Minister, the Most Honorable Hubert Minnis, as one of the immediate responses to addressing the basic needs of food assistance to the citizens and residents of the Bahamas due to the widespread impact of this COVID-19 pandemic. Mrs. Susan Larson was appointed as the chairman of the task force, which encompasses the partnership of the following non-government organizations: the Bahamas Feeding Network, the Bahamas Red Cross, Lend a Hand Bahamas, Hands for Hunger, the National Food Committee of Grand Bahama, IDEA Relief in Abaco, and the One Illustre Foundation. I take this opportunity on behalf of the government of the Bahamas to extend appreciation to Chairman Larson, the zone leaders of the task force, and their support teams for the Herculean work they have done. The National Food Distribution Task Force timeframe was to operate from the last week in May to the end of August. To date, the government has provided funds in the amount of $13,225,341. The National Food Distribution Task Force has distributed food parcels and vouchers to approximately 55,078 households throughout the Bahamas up to September 12th. The need for continued food assistance through the task force is still of paramount importance, and as such, the government of the Bahamas has committed to the continued partnership to the end of October 2020. The process of feeding our fellow brothers and sisters remains a major priority for the government of the Bahamas. Therefore, we wish to advise that persons in need of food assistance can apply to the Department of Social Services, as well as various non-governmental organizations which provide food assistance to the most vulnerable. It should be noted, however, that persons are not intended to receive from both entities. The email address for the National Food Task Force is nfd@rapidbahamas.com. I repeat, nfd@rapidbahamas.com. COVID-19 assistance adjusted emergency food assistance rates. We will recall a program put in place for persons in the hospitality industry who were placed on reduced work weeks in March of this year. 2,293 persons were assisted at the tune of $270,600. But COVID-19 initiatives continue. Child Protection Unit. Children are the most vulnerable to external shocks and factors such as this global pandemic. It is those perceived as least powerful who feel the brunt of the needed lockdowns and extended curfews. Through diligent and consistent focus, emergency intervention for cases involving child endangerment has not been changed. Virtual home visits and telephone checks are carried out on stabilized cases. Court visits continue. Additionally, within the child care facility units, social workers' visits to child care facilities continue, as well as telephone contacts with the administrators regarding the well-being of residents. During the COVID-19 lockdown, 3 of our female residents absconded. I'm pleased to report that one of them have been located just last night. I'm also pleased to report that during this pandemic, none of our children tested positive for COVID-19. The police are working along with us to locate the other 2 girls. The Adventist Disaster Relief Agency donated a total of 84 tablets to all of our child care facilities. The National Parenting Program is vital to ensuring strong families and resilient communities. Despite COVID-19, parenting classes continue. However, they are conducted virtually. 838 parents have participated. Assignments are sent to parents via email. Anger management sessions are held separately with individual in-person interaction. 150 persons have participated. To date, 24 sessions have been held with virtual graduation and presentation of certificates. Trafficking in persons, a form of modern-day slavery, is a violent act, one that the government of the Bahamas, along with the people of the Bahamas, have said and proven zero tolerance for. Since the pandemic, 7 trafficking victims were assisted by the Department of Social Services. This number has been reduced to 2, with face-to-face interaction and safety protocols being practiced. The other victims returned to their countries of origin, but the department's TIPS representative continues to provide supportive care by regular communication via emails and social media. Reports of unaccompanied minors were brought to the department's attention by the U.S. Coast Guard on 2 separate occasions. Social workers traveled to Inagua from the 17th to the 20th of July and to Ragged Island on the 27th of July. Thankfully, interviews with the children revealed that they were not human trafficking victims. Grand Bahama and the Northern Bahamas. On our sister island, Grand Bahama, a spirited, vibrant community who has managed and continues to own their lives and space, has fared the worst of the storms. I can report that there was steady increase in requests for assistance due to COVID-19 and its impact on the economy of Grand Bahama. During the period of March to August 2020, there was an increase of demand for rental assistance and a steady increase for financial assistance for utilities as a result of persons being furloughed or in some instances terminated due to the economic fallout of the pandemic. However, during the months of July and August, there was a decline in requests for emergency food assistance, as many of the department's clients utilized the Feed Grand Bahama online initiative offered by the Bahamas government in response to the pandemic. 4,850 persons benefited from emergency food assistance at a cost of $437,713. The Adventist Disaster Relief Agency donated food parcels and baby items to the Grand Bahama community. Our Family Island Division. The Bahamas is not Nassau. The Ministry of Social Services is not New Providence-centric. The Family Island Division of the Department of Social Services is actively involved in the delivery of all programs provided by the department. The most vigorous is always our Community Support Services Division programs that assist indigent in the various communities. Persons who were previously able to extend benevolence were now themselves in need of benevolence. In islands where the tourism industry was more vibrant, needless to say, they were more negatively impacted. Thus, the creation of the digital application and the increase of some of the benefits, as it was expected that the timelines for the need of the services would be shorter. Between the period of April and August 2020, the following assistance was provided to 5,286 persons at a cost of $843,639 throughout the Family Islands. In keeping with the assistance provided in New Providence, 16 non-governmental organizations in 14 Family Island districts received a total of $31,000 to assist with feeding programs that were similar to those initiated in New Providence by the Bahamas Feeding Network. Partnerships, which is most important to us in the ministry. We were privileged to partner with the Lenny Kravitz Let Love Rule Foundation, and the Department of Social Services received a donation of $100,000 in gift cards redeemable at Solomon's Food Stores. The cards were distributed throughout the communities of New Providence at $60,000, Grand Bahama at $15,000, and Eleuthera at $25,000. Distributions focused on the most vulnerable among us, inclusive of persons with disability, the elderly, and single mothers. An additional $100,000 was just received and will be distributed accordingly. Urban Renewal has been a key stakeholder, a mobile force in the time of this pandemic, ensuring that the elderly are not forgotten, that the homeless, who have been exploited through social media and ignored, receive rations, receive care. Thank you, Urban Renewal. To this highly dedicated team working in various urban renewal communities. Due to restrictions and protocols put in place in the workforce as a result of COVID-19, Urban Renewal has had to adapt by adopting alternate and innovative means in facilitating the public. Grocery bags were distributed in April and May to the tune of 600 bags, distributed to senior citizens and other residents in need in New Providence. An additional 300 bags were distributed in Grand Bahama. Grocery vouchers were also supplied for those in need on the Urban Renewal Family Island locations of Abaco, Crooked Island, Long Island, Andros, Cat Island, Exuma, and Eleuthera. A Taste of Love breakfast was distributed on the 10th of June to over 2,000 persons, 200%, provided with hot cooked breakfast from 10 urban renewal centers here in New Providence. They also held a Father's Day television presentation with private honors ceremony, as Urban Renewal was unable to hold its annual Father's Day luncheon due to the COVID-19 restrictions. As a replacement for the annual summer program, hot lunches are today being provided by 10 urban renewal centers in 10 of our communities here in New Providence. The lunches are primarily picked up by parents of the children. The lunch program began on Monday, 7th September, and will end on the 25th of September. Grand Bahama's Urban Renewal is also hosting a similar lunch program. Approximately 1,600 children daily will be fed through this lunch program in New Providence and Grand Bahama. Also, 100 in Bimini. The Department of Gender and Family Affairs noted that the emergency orders curfew COVID-19 recovery experiences prevented various challenges to the productivity of life and well-being in the Bahamas and in countries across the world. In response to queries, complaints and requests for assistance regarding challenges of increased violence, family feuds, depression, anxiety, loneliness, fear, and generally a need for help, the Department of Gender and Family Affairs, in conjunction with the University of the Bahamas, conducted an online survey to ascertain the safety, well-being of families during the COVID curfews and lockdown experiences. The results suggest a slight increase in family violence in homes pre-COVID and during the COVID lockdown. The Department of Gender and Family Affairs continue to work with non-governmental organization partners to monitor the occurrence of violence. In conjunction with government and civil society partners and affiliates, the department hosted various virtual trainings, seminars, workshops, and town hall meetings to address some COVID challenges. Themes and topics included psychological well-being and support, impact of COVID-19 on men, women, and families in the Bahamas, the role and response of non-governmental organizations during COVID-19, non-governmental organizations' guidelines to apply for grants and international funding, how to strengthen business during COVID-19, the role of the church during COVID-19, social assistance for support for families during COVID-19, dealing with the stigma of contracting COVID-19, and the role of men in the family. A multi-stakeholder intersectorial council provides training, advice, and guidance for families. The council is represented by the Department of Gender and Family Affairs, Department of Social Services and Urban Renewal, the Ministry of Health, the Ministry of Education, the National Women's Advisory Council, the Royal Bahamas Police Force, the Training Authority, Civil Society Bahamas, and the University of the Bahamas. The Department of Gender and Family Affairs also participated in several regional and international United Nations high-level roundtable meetings, reaffirming the Bahamas' commitment on its international responsibilities, including understanding the nuances of COVID-19 throughout the Caribbean and the world, and the sharing of best practices. These meetings included UN Women and IDB gender equality experts held on July 21st. I had the privilege of being a panelist. UN Women and Pal Americas Eastern Caribbean Parliamentary COVID-19 high-level roundtable meeting, which was hosted by the Parliament of the Bahamas on 29th July. Participants included the Honorable Speaker, the Honorable President of the Senate, Senator Reynard Henfield was the moderator. I also had the opportunity of leading the Bahamas' delegation. Also in attendance were members from the opposition and House of Assembly and Senate. The Commonwealth High-Level Meeting for Ministers of Women Affairs, where the Bahamas made an intervention on economic empowerment for women, Latin America and Caribbean COVID-19 recovery efforts, CARICOM consultative meeting for 2020 to 2030 strategic plan, 8 Department of Gender and Family Affairs technical officers participated and provided interventions and recommendations to CARICOM Secretariat. We continue to address our international reporting obligations. The National Commission for Persons with Disabilities, utilizing the digital trend that COVID-19 has sped up in many of our ministries and affiliate departments, We've upgraded the technological infrastructure to meet clients wherever they are. The National Commission for Persons with Disability has used this time to transform the avenues in which to assist persons with disabilities. Two major technological shifts at the National Commission continues to work towards the improvement of disability services. The disability register is steadily progressing. The mobile app is being developed so that the National Commission for Persons with Disabilities are able to inform communications, and we're presently receiving quotes for that app. Technology have increasingly become important and necessary in a digital age, and access to ICTs is one of the greatest equalizers for persons with disabilities. ICTs can become life-changing tools for persons with disabilities, enabling them to more fully participate in various aspects of society. The National Commission for Persons with Disabilities purposed the development of a mobile app for persons with disabilities and their families. The primary purpose of the app is to serve as a portal where persons with disabilities and their families can have access to accurate, timely, and reliable information with regard to disability-related services and support. The app's feature will provide one-touch access to all emergency services, including text services for the deaf and hard of hearing, name and contact information of all government departments, agencies, and services frequently used by persons with disabilities and their families, name and contact information of nonprofit organizations, name and contact information of disability-related organizations, the National Council for Persons with Disabilities registration form. Also in consideration is a digital identification card for persons with disabilities. This is being proposed in conjunction with the National Insurance Board on the possibility of NIB cards, including some indication that the holder of the card has some disability, similar to what currently is in place for seniors. The Commission would like the possible option of persons with disabilities having a word or symbol for disability imprinted on their NIB card. Alternately, there exists the consideration of the Commission issuing a standalone card. An additional option is a digital ID card, which is proposed to be a part or link to the mobile app. The push notification for the national alerts, emergency and disaster news, access to video relay services, a video telecommunication service that would allow deaf or hard of hearing individuals to communicate over video devices and with hearing people in real time using a sign language interpreter. Access to visual assistance service, a video telecommunication service that allows blind and visually impaired individuals to receive visual assistance through a live video called, example, Be My Eyes. Additionally, the NCPD during the pandemic worked on updating the registry of persons with disabilities. This list is also required for disasters to know where each person with a disability is located in case evacuation is required. This list is also mandated by the United Nations. Information technology communications. Continuing the digital trend that the government of the Commonwealth of the Bahamas initiated in 2017, the Ministry of Social Services and Urban Development formally launched its digitization and modernization process with a deputy director at the helm in 2020. Under the digitization and transformation strategy of the ministry, there were three main goals. One, speeding up the launch of the department's management information system was key to meeting the challenges of COVID-19. Promise is an upgraded, streamlined, and more comprehensive database that provides processing, monitoring, tracking of cases, and disbursements of all assistance, all in one place. The creation of a technical unit called the ITC unit to process applications, card services, and queries. The ITC unit provides support to the Department of Social Services through the processing of online applications from COVID-19 special initiatives, which evolved into COVID-19 impact assistance. The integration of digital wallets as part of an efficiency measure in line with the central bank regulations. With the realization of our clients' need to access their social assistance quickly and more efficiently, the ministry, through the ITC unit, held 3 stages of beta testing, employing the digital trend of digital wallet providers to disburse food coupons and rental assistance. Through the ITC unit, and in partnership with the Ministry of Education and the Department of Transformation and Digitization, the Ministry of Social Services will upgrade all of its community services centers and all of our urban renewal centers by providing hotspots and accessible Wi-Fi. Expanding our Wi-Fi access allows students in these urban communities to be able to attend virtual classes in their areas if internet connections are not available in their homes. Moving toward online digital processes allows for less face-to-face transactions, lessening the lines and widening accessibility. It was imperative in the COVID-19 environment that we assist where possible persons with shelter. Imagine trying to wash your hands while living in your car. The ministry's digital transformation will also improve efficiency and efficacy of service while also providing the government of the Bahamas with accurate, real-time data with which to make projections and decisions. Digitization will also fulfill the ministry's goal to be even more transparent and accountable to the Bahamian people. The ministry's digitization and modernization process via the ITC unit will allow officials to manage client information from the time they access the online application to the time when they become sufficiently independent that they no longer need social assistance. There will be ongoing training because based on the philosophy of total quality management, if we can't do it better, we'll find a way to do it faster. The value of the social assistance system, what it means to them, and what it means to the client to buy into the philosophy of moving from a 100% paper society to a 100% paperless society within the Ministry of Social Services and throughout the government of the Bahamas. COVID-19 has affected all of us. COVID-19, that invisible enemy, is like a storm. The Ministry of Social Services has tried to ensure that no matter where you may be during this storm, this pandemic, that you and your families have the protection of our safety, social assistance, and network, a measure of food security also. Additionally, we have maintained our day-to-day work to avoid a singular focus on COVID-19. Together, arm in arm, while 6 feet apart, shoulder to shoulder, while physically distancing, we can meet the challenge and face this invisible army, this invisible enemy. In my devotions this morning, I read from Ecclesiastes 3, which speaks about a time for this and a time for that. And the suggestion is that opposites can't coexist because it talks about a time to be born and a time to die. I'm suggesting that there is a time when we ought to be concerned about self. Concern about self in this COVID environment will also translate into concern for our fellow man. And so I invite you, I entreat you, Bahamians and residents everywhere, make it your personal commitment, your personal responsibility to avoid being affected or infected by COVID-19, and you will thereby be ensuring that your brother and sister doesn't catch it from you. Thank you very much. May God continue to bless the Ministry of Social Services and Urban Development as he continues to bless the Commonwealth of the Bahamas.
Thank you, Honorable Minister. At this time, we'll entertain questions from the press. First, we have from Eyewitness News, Mr. Matthew Moxie. Mr. Moxie, do you have a question, sir?
Yes, good afternoon.
Good afternoon.
Minister Campbell, many people have complained not only about the poor attitudes of the social workers when they are interacting with taxpayers seeking assistance, but also quite plainly that they cannot receive assistance as it pertains to rent or get any response or update on their applications, some of which have been in since April. How many people have signed up for rental assistance and how much money has been dispersed for rental assistance to date during this pandemic?
Okay, I'm not so certain, Minister. Are you? I will defer to our acting director who is here, as well as Minister, who wants to speak directly to it.
Let me speak to the complaints about attitudes of our staff. Let it be known here that the position of the minister and the management staff is that everyone ought to be treated with respect, that our social workers and supporting cast ought not to be judgmental or harsh in their treatment of clients. I started off by reminding our team that while today we are on this side of the table offering service, but for the grace of God, tomorrow we could find ourselves on the other side of the table seeking assistance. As the humanitarian arm of the government, our job is to ensure that people leave our premises with their dignity, even when we're unable to fill their requests. As for the numbers of persons who have applied. I don't have that with me. I believe someone from the team, we don't have that. I don't have the numbers, but I can say part of the difficulty, if you would recall, initially, the Prime Minister had indicated that he had communicated with the lending agencies to defer mortgage payments. And it was his hope that that deferral would translate to a deferral of rent payments by tenants. We began to realize that that wasn't working out, and we reviewed our ability and resources, and as a result, I can say that we are now processing rental assistance. Some persons have already received their rental assistance. I want to assure those who have been waiting that they will also be responded to. Thanks.
Is there another question? And just to note that we will be entertaining 2 questions per entity. And of course, what we are unable to address today, we undertake to do so through our press liaison officer with BIS, Mr. Matt Morrow. The next question, is there one?
Yes, my next question is also, why is it so expensive to relocate these borders at the hospital? What does this grant figure entail?
Expensive is a relative term. And when you relate that to the near $6 million that was being spent or paid for them while they were in hospital, I think the cost is quite inexpensive.
Okay. Jiminy the Screen of ZNS.
Good afternoon, Minister. Good afternoon to your panel. My question relates to those as it relates, I think you mentioned your ministry addresses suicides, and of late we have seen a number of attempted suicides or suicide cases under investigation. Are there any plans to bolster those programs in light of the level of assistance that's already been extended and in light of what we're seeing now based on the downturn due to coronavirus?
The ministry is fortunate to be partnering with a number of non-governmental organizations. And so it isn't the ministry itself that provides the counseling services. We rely on, in part, the Ministry of Health. We rely on entities like the Crisis Center. And so we're hoping that, as you would have heard, our attempts to improve capacity within our partners, non-governmental organizations, that we can build capacity in that area and improve our ability to have more services offered in that regard.
Is there a second question, ma'am?
Thank you. Yes. My second question, if we could just go back to the issue with the borders. What is, if the minister could just clarify, what would be the long term for them? He notes that it's $800,000 that's going to be expensed, which is much lower than the $6 million that was being expensed at PMH. But what is the plan moving forward as it relates to this relocation?
Okay.
Jimenita, what would be ideal for us at the ministry is if the children and loved ones of those borders would find it in their heart to pay back what I'm sure those borders would have extended to them in their formative years. Without going into detail, I'm sure, without fear of honest contradiction, that a high percentage of those borders have family members who I hope are listening to me right now, and I hope will be touched that they will go and find a way to work with us to either reduce the expense, or those who have a greater means take over the responsibility of caring for mommy and daddy and uncle who would have once cared for them.
Next, we have Jasmine Brown of Our News.
Good afternoon. The question is for the minister. I know you outlined how much the government has spent so far on the food distribution task force. I think just over 13 million, and you had indicated the program was supposed to end, I think, at the end of August, but the government is now committing to continuing on till the end of October. My question is, how much more money can social services provide? And given the fact that the pandemic is ongoing and we don't know when we'll see an end, what happens in October if there are still people in need of food?
Truly, my hope is that the appeals that are being sent from various ministers, the Prime Minister in particular, asking for persons to adhere to protocols, for persons to take the kind of personal responsibility to help us reduce the transmission and enable us to safely reopen the economy, in particular the tourism sector that generates much of our funds, that will reduce the need for persons to be seeking the food assistance. That said, food, shelter, and clothing, I believe in that same order, are man's basic necessities. And as a government, we are obliged to do all we can to provide that for as many as we can, for as long as we can.
Your second question, please, ma'am.
And then to follow up, I think on a question that was asked previously about the 800,000, I think we want some clarity on what exactly the 800,000 will be spent on for these boarders who are being relocated.
I think the boarders are being relocated to various senior citizens' homes, all of which are not government owned. And so at least 25 of them, if I'm not mistaken, are being taken to a home that is not government owned. So that's where the chunk of the money is going. Also appreciate that those boarders are at an age where they call for additional care, constant care. And so we are paying to ensure that those boarders, while taken out of the hospital, are not treated any less, are not given any less attention than they would have been receiving at the Princess Margaret Hospital.
Karen Bain of Global 99.5 in Grand Bahama.
Yes, good afternoon. My question is in regards to the children from Grand Bahama and Abaco who were sent to Nassau due to Hurricane Dorian and had to stay there due to COVID-19. Can we get an update as to how they are doing and what is happening? Are there any plans for them to return?
Yes, I'd like to invite now our Acting Director of Social Services, Mrs. Lillian Kwan-Forbes, to respond to that.
Good afternoon. Our children from Grand Bahama are faring well, in spite of the trauma that they would have experienced with Dorian. I'd like to say at this point in time that we are in negotiations of having our kids returned to Grand Bahama. And so I've had dialogue with Bahamas Air, who's going to partner with us to take our kids over on the 2nd of October on that midday flight. And so the entourage will be headed by our minister, who will accompany our kids back to Grand Bahama. I'd like to also say there are 30 children who are going back to Grand Bahama for the Grand Bahama Children's Home. However, we're still in the process of trying to identify a place for our children from the Columbus houses for boys and girls for them to be accommodated. And as soon as we do that, we will then relocate those children to Grand Bahama. But other than that, overall, our children are doing as well as can be expected. They are getting excited, And the ones are older kids who are not going on that flight on October 2nd. They are realizing that their day will come. And so at this point in time, Grand Bahama is getting very excited and expecting them. Thank you so much. As it relates to children from Abaco, we didn't have any children from Abaco specifically. And so any of the children who were in the children's home or in the Columbus houses, and if they were from Abaco, then they would have been included in the number. Thank you.
Okay, ma'am, do you have a second question?
Yes, thank you very much. What is the strategic plan of the Department of Social Services in conjunction with the National Training Agency to assist those persons who have lost their jobs and get them professionally developed for the new turnaround when everything is open?
Okay. I would like to not only include the Department of Social Services on this, but I'd like to invite Dr. Jacinta Hicks, Director of the Department of Gender and Family Affairs, to speak to that, because that department has certainly been doing work in that area. Dr. Hicks.
Thank you so very much for the question. The Department of Gender and Family Affairs is very thankful to Templeton Foundation. We received $25,000 in the first instance, and we have partnered with Bahamas Youth, Urban Youth Development Center. That's Mrs. Podesta Moore, so one of the major NGOs, local NGOs, and they are going to do full training with regards to young persons, economic empowerment for women, as well as training with regards to COVID-19, new business protocols and skills. Thank you.
Thank you, ma'am. Ms. Sasha Lightburn of Our TV.
Yes, good afternoon to all. I just want some clarification. My first question, the minister spoke to the Food Distribution Task Force as well as emergency food assistance. Can you give me the differentiating factors between those two programs?
Okay, I'm going to invite Director of the Department of Social Services, my acting director, to address that, since that falls within her purview.
The difference between the National Food Distribution Task Force, that is a task force that was specifically designed and created to address the needs of persons who were affected as a result of COVID-19 and the downturn in the economy. As it relates to the emergency food assistance, the Department of Social Services offers assistance throughout the year, whenever the need is, whatever the need is. And so persons have gotten that assistance. Now, I don't know clearly if you're meaning the emergency food assistance specific to food, or are you speaking about the special grants that we talked about earlier? No. But for food, if it is for food, then those are the rates that have been implemented as a result of COVID-19, and also to our ongoing assistance, regular food assistance, okay?
Okay, another second question, please.
Thank you so much. My second question is with respect to the minister noting that data suggests that violence has increased within the homes, maybe particularly within families. Has the Department of Social Services had to go into any homes and particularly remove children from those homes?
Okay. I'm going to defer to our Assistant Director, who's going to speak to that, and then I would also like to give the opportunity to our Director of Gender and Family Affairs to speak to some of the work that has been happening in that area. Mr. Valier.
In terms of persons coming to our attention as a result of domestic violence, most of them have come into the department seeking accommodations. And that is where we have gotten a whole lot of our referrals. Persons have come seeking help, saying, I'm in a bad situation. Could you please help me to get out of that? Could you please provide a reprieve for me during this rough time? And that is where we've had to come in and offer help.
Thank you very much for the question. The Department of Gender and Family Affairs, in conjunction with the University of the Bahamas, conducted a survey, an online survey, with regards to increase or lack thereof violence in the home pre-COVID and post-COVID. Our initial data suggests that by 2% there was an increase in persons in the survey that reported violence. Unfortunately, there's a twist in the results. The direct indicators is that the mothers were the ones that contributed toward the violence in terms of beating or rowing, etc. One case of violence against women is one too much, or against a child. And so therefore, we now are trying to triangulate our results with the Bahamas Crisis Center, and definitely from February until April, 33 persons called in to complain again about violence, etc. So that's the number we have. We are now awaiting the results from the Ministry of Health and also from the Royal Bahamas Police Force. Thank you.
Thank you, Dr. Higgs. Sloan Smith, Eyewitness Digital.
Hi, yes, good afternoon. Thank
Good
you so
afternoon,
much
ma'am.
for the question. So my first question is just, once again, a clarification on the borders. We know that some have already started to be relocated. Can official just kind of clarify on when the rest of those borders are expected to be relocated?
Okay, Acting Director will speak to that.
The borders are going through the proper COVID preparations and testing prior to leaving PMH. And once everything has been sorted out, then they will then relocate to the various homes. Thank you.
Ma'am, you have a second question?
Yes, in June, social services officials would have described, I guess, the continued response to Dorian as officials still being in the trenches. Can we kind of get an update on what that response continues to look like a year after Hurricane Dorian, and specifically those shelterees who were being sheltered throughout different shelters in New Providence? Where are they at right now?
Okay, I think it would be useful for us to have an overview of what happened. Director, you're going to speak to that, please, because we would have had two shelters still in operation. As you know, they've already been closed, but certainly she can add some additional information to that.
Last year, we started off, I'd say, with just so many shelters and trying to accommodate so many persons as a result of Hurricane Dorian. Here in New Providence, as you had indicated, our staff had been tasked with accommodating so many. One of the things that we found, too, is that in the midst of it all, there is a beginning, there's a middle, and then there's an ending. And so at the end of it all, I'd like to say that we finally closed our last shelter, which was the Bahamas Academy, Seventh-day Adventist Academy Gymnasium. And so that would have been closed at the end of July. The numbers of persons who we would have assisted, many of them we found and we helped with rent. Many of them we would have helped with tickets to return to their place of origin. And those others are still here among us, and we are assisting them with rent, with food assistance, with whatever type of assistance. Also, too, you would have remembered, or you would remember that we had the Kendall GLI 6 Gymnasium, and when we would have relocated the persons from there, we rotated them to Poinciana Inn, and that was a temporary venture. It was set for 3 months, And then at that point, we were able to finally move all of those persons out of that facility as well. So I say at this point, thank you to the staff of the Department of Social Services for their hard work, and to our colleagues who've worked with us shoulder to shoulder, and also to various organizations in the Bahamas and in New Providence specifically, who've been there with us during the course of this time. Thank you.
Thank you, Director. We now have questions from Sir Marco Lightburn, who's all the way in Exuma. Mr. Lightburn?
Good afternoon. So my first question regarding the COVID-19 charitable special grants, what are some of the protocols put in place to ensure that projects are executed as outlined and that all of the money is spent in line with the ministry's vision? We are in an era where there has been, unfortunately, several public disputes of philanthropic funding being misappropriated.
In most cases, and I will say this with our grants that are issued, whether they're through the Department of Social Services or through any of our other entities under our portfolio, there is a reporting requirement. And so in this instance, that would apply as well. They will have to produce their reports indicating how the funds were spent, and they are to be inspected in due course by our team. Do you have a second question, sir?
Thank you. Yes, and secondly, the ministry has made a significant stride in upgrading from what would have just been the food vouchers, and now we do have a card that allows for greater flexibility. One of the difficulties for Exumians, for example, was that the voucher was regulated to one specific business. Can you elaborate if this upgrade allows persons on social assistance more variety in where they can now spend?
Okay, are you speaking to our context of the digital wallet in that context, or still the voucher system and expanding our vendors? Could you clarify for me?
Right, the voucher system, that's correct.
Okay, the voucher system. Director?
If you're saying in Exuma there's just one vendor that accepts or recognizes the card, then if there are other vendors who wish to sign up, then they can do so. And they would then be able to use the card wherever. But that is something that the vendors or the merchants themselves need to do with the banking institutions to put in place that card machine. Yeah? Thank you.
Thank you. I think you've had just two questions. Tyler Simonet of JCN.
Hi, good afternoon to the ministry and team, and good afternoon to the Bahamas.
Good afternoon.
For my first question, on September 9th, we saw the Commonwealth Secretariat and the No More Foundation. They launched a campaign designed to help tackle the rapid increase in domestic violence and sexual violence due to COVID-19, and a number of political leaders spoke on it and joined the program, the campaign. Has the Bahamas been included in this campaign? And also during his speech, Minister Campbell did mention the increasing domestic violence that's been occurring in households. Can we get some official numbers on how much it's increased since the pandemic started? Is it a very significant spike or no?
This to the Department of Gender and Family Affairs because they have had oversight of this area and has done considerable work.
Please let me begin with your last question with regards to specific numbers. So at this point, we are unable to give specific numbers. Our research that we did is still waiting for information to be triangulated, means to be verified with other sources, including Royal Bahamas Police Force. And so we are waiting that data, as well as from the Ministry of Health, the hospital. Crisis Center, as I said, we got their numbers as already. With regards to the Commonwealth, so yes, the Bahamas, we just participated in a Commonwealth meeting and initiatives of gender-based violence reduction, intervention and prevention. So we are now working with them. We are just now waiting for the outcome document. There's a final outcome document that we will be guided by, that will be agreed upon by all of the countries. With regards to gender-based violence intervention, there is a program called Spotlight Initiative. And so the Bahamas is now working with CWIL, that's the Caribbean Institute for Women in Leadership, and also Women United, so that we can now launch Spotlight Initiative, which is a United Nations program being done all over the world with regards to awareness and, again, reduction in gender-based violence. Thank you.
Thank you, Dr. Higgs. I think you have another question.
Yes, thank you for that response. Minister Campbell, you mentioned during your speech that no one should be applying for 2 different food assistance programs at one time. Have you seen many instances of people doing this? And would you say the reason for them applying for 2 programs is because they require more food than one program has to offer? Or do you believe there's some other reason for them to be doing that?
Minister.
I can't give a number, an accurate number, on persons who may have applied for both. In their defense, if I were to find one, it may be because there may have been some delay in the first instance, and they thought it necessary to try another avenue. But the fact of the matter is, both assistances are being provided by the same one government. And so if it is allowed for persons to double dip, for lack of a better word, it then denies some other person of the opportunity of receiving some assistance. And you have to appreciate the numbers of persons who are likely to be seeking assistance owing to the downturn in the economy necessitates our ensuring that whatever is available is spread out sufficiently that everyone can get a slice of the cake, as instead of one person getting a whole half and then you have a crowd not getting any.
Thank you, Minister. We now have Leandra Roll from the Tribune.
Good afternoon.
Good afternoon. ma'am.
Just a follow-up question to one that was asked earlier as it relates to shelters. We know officials had said that all shelters has been deactivated and some of the shelteries have since transitioned elsewhere. But can officials say exactly how much money was spent to run those shelters during the times that they were in operation?
Well, at this time, we wouldn't be able to give you the exact figures, but certainly, if you'd like to contact us in the future, we'll be able to provide that for you, but we don't have them available today.
Okay.
But I can give some clarity in terms. 1 second, please.
I'm pleased to report that for the most part, the venues were free. They were as a result of churches and other institutions allowing us to use their facility. And then you would recall that there were a number of non-governmental organizations involved in the feeding. And so, for the most part, I'm satisfied to say, based on the numbers of persons that were accommodated throughout that ordeal, whatever the final cost is will not be anywhere near to what the actual numbers of persons that we were able to assist during that time.
Thank you, Minister. There's one additional question, if you'd like.
Yes, I also wanted perhaps if officials could also give an update on the response that's been happening on the grounds in APCO and Grand Bahama. I don't think that was a question that was asked earlier, but I don't think she got a response. For example, I know that officials were still distributing vouchers to help residents purchase furniture supplies and other items. Is that still going? Is that still ongoing? And can you say how many vouchers have been distributed to residents in APCO and Grand Bahama, if possible?
Okay, I'll ask Acting Director Kwan Forbes to speak to that. It is ongoing, but she will elaborate further.
The assistance, financial assistance for appliances and beds still ongoing as a result of Hurricane Dorian in Abaco and in Grand Bahama. It's an ongoing process. And also rent assistance. And so in terms of the being able to give you the numbers, that is not something that I can give to you now, but we're noting it, and then you'll be able to follow back up with us afterwards. But it's still ongoing. Thank you.
Okay, thank you. Ladies and gentlemen, we've come to the close of our press briefing. We thank you for your participation. And as the Permanent Secretary of the Ministry of Social Services and Urban Development, I want to say thank you and ask for your continued patience as we work towards addressing the needs of our community. Thank you.